Welcome to LanguageLine Conversations. We are so excited today to have JD McFarland from Mend. As you'll find out, Mend is a really exciting company. They provide integrated telehealth solutions for modern medical practices. JD, welcome. How are you today?
Great. How are you?
I'm doing very well, thank you. As I understand it, and correct me if I'm wrong, you have a unique perspective. You were a client of both LanguageLine and Mend prior to coming to the position you're in now.
Absolutely. I've worked in behavioral health technology for almost my entire career, 20 years. And of course, in behavioral health, language services are critically important. And LanguageLine was the vendor that I used for my entire career. And my relationship with LanguageLine outdates my relationship with Mend, but I was fortunate enough to also be their customer before getting the chance to work for them.
Well, we're happy to have the opportunity to work with you once again. Tell us a bit about Mend. It's a really exciting company and very innovative. Tell us a little bit about Mend and its position in the marketplace.
Mend is a patient engagement software company. So our core product is telehealth, but we build all the tools around that to actually let practices engage with their customers, transform their brick and mortar workflows, and take them up to a digital world. So things like digital forms, e-signatures, satisfaction surveys, notifications, reminders, anything you need to do to make your practice work in the digital world, we can support that.
JD, it seems from the outside that telehealth has gone from a crawl to a sprint the past 18 to 24 months. Do I have that right?
Oh, absolutely. We saw more growth in 2 months than we did in 15 years. And things have stabilized, but we're still looking at a 38x jump over where we were pre-COVID.
That is amazing. And likewise, are you seeing some commonalities between the virtualization that's happening in the medical field and other areas of our lives, like shopping and things like that?
Absolutely. People expect healthcare to be easy and accessible, and they want to be able to do it on their terms. Essentially, now more than ever, the consumerization of healthcare is becoming true, and telehealth is a big part of that.
Now, 1 out of 5 U.S. citizens speaks a language other than English at home. And in some states like California, New York, Texas, that might be as much as 50%. What percentage of your customers need interpretation services when they come to Mend?
It's almost 100%. It's literally a conversation I have with almost every customer. And the reason is because if 1 out of every 5 people in the United States speaks another language, that means in your community, in the area you serve, you're almost certainly going to have to serve someone who speaks another language.
Now, what Mend did was you added one-touch, always-on access to interpreters to your platform. What was your goal when you decided to do that?
The goal was to make it easy and to be able to expand care to as many people as possible. A lot of our customers are in areas that have large populations that don't speak English, and they're not just Spanish. We have a large group who has a large Nepali population. So we have to be able to bring in interpretation services for just about anything. And making it easy is critical because, especially now, as we talked about with consumerization, patients might just decide they want to see an appointment or they want an appointment right now. They don't have the ability to schedule it in advance. So the providers have to be able to just click and get someone from LanguageLine in the call to do the services.
That's really amazing how fast this has happened. Can you tell us about the process that was involved in bringing on-demand interpretation onto the platform?
Yeah, basically it started with customer feedback. At Mend, we're very focused on listening to our customers. And we like to say our best tools were directly designed, or I shouldn't say designed, they were in response to customer requests. And so we listened to what they need, and this was one of the big needs. So we tried to figure out the best way to do it. And ultimately, that's what ended up rolling into the software.
JD, now that interpretation has been integrated, what is the user experience like? How easy is it to bring an interpreter into the conversation?
Literally, you click on a plus button within our user interface, and you are able to click on a button that you have mapped for the interpretation service, and you can have speed dials for different languages, or you can just call the general number and actually be able to go through the phone tree, get them on, pull them into the service.
Amazing. Now, we understand what the benefits are to the limited English speaker, but can you speak to the benefits staff productivity, enhanced compliance, things like that?
Absolutely. A large number of our clients actually have contractual obligations to provide interpretation services to their clients. So it's not an option for them. They have to do it. And to the productivity side of things, if they've got to schedule it in advance, so if a medical assistant, say, has to call up LanguageLine in advance, get someone scheduled to be on that call, you might have just added 5 to 15 minutes. And if you're doing 2,000 appointments a month, all of a sudden that's full-time positions. So being able to actually streamline that process has a major impact in the productivity that our agencies are seeing.
And what sort of feedback have you received as to how the integration has gone?
Customers love it. It's gone from a feature that didn't exist to one that I can't imagine not existing.
And I mean, that's wonderful to hear. Now, forecasting out, what do you see as the promise of telehealth in terms of its ability to remedy some of the minority health disparities that have really plagued our society for so long?
Yeah, absolutely. You look at the social determinants of health and you see that across all specialties, weaker outcomes. And the language barrier is a huge part of that. Think about if you can't speak the same language as the person that you're trying to actually get help from. I mean, it's bad enough that I can't pronounce half the conditions or the medications, but if I can't even talk in simple terms, it's going to be a problem. And if you have to rely on maybe an adult medical caregiver to help do that translation, now you've just brought a whole nother person into the loop. It's going to be a barrier. Being able to just go online, click a button, have a visit, and have someone who's able to speak your language is going to radically improve care.
And JD, to conclude, I'm going to ask you really the biggest question of all. If we look out, say, 20 years, what does telehealth look like?
Honestly, I don't know. I look forward to it. I think that in 5 years, it's going to be hard to say, but I think the reality from here on out is we're going to have a hybrid model of care. There's some things you're going to need to go to the doctor for to actually get poked, prodded, stuck, blood taken. But increasingly, there are providers that are actually bringing those services to you in your home. And I think you're going to see a much more logical approach to when we need to pull patients into the office and disrupt their daily lives versus when we can actually treat them effectively in their homes.
JD McFarland, thank you very much for joining us on this LanguageLine Conversation.
Thank you, Scott. My pleasure.